Are you a night owl, or do you consider yourself more an early bird? On today's episode, we'll talk about a disorder that could be contributing to your ability to stay up and watch all of that late night television. I'm Jay, and this is Somnilopod. Hello, everyone. Welcome back. If the answer to that question that I posed in the intro is night owl, then you might find some insight in today's episode. Today, we'll be talking about delayed sleep phase syndrome. Now, the clinical definition of delayed sleep phase syndrome is sleep that is delayed late into the night by at least 2 hours, making it difficult to awaken at the socially acceptable time. Boy, that is dry as toast, isn't it? And if it sounds familiar, then it probably means that you have listened to some of my other episodes. It sounds a lot like insomnia, especially sleep onset or sleep initiation insomnia. The difference between the two can be very subtle. So subtle, in fact, that a lot of patients that present with insomnia, up to 10% of them actually have sleep phase disorder instead of insomnia. So, what is the difference? Well, both involve difficulty initiating and maintaining sleep at the desired time. Both have symptoms of daytime sleepiness and fatigue, and both can affect our school and work and life obligations. So the real kicker is that delayed sleep phase is actually a disorder of your circadian clock. Now, we've talked about circadian rhythms in the past. These are the things that our body uses to help us sleep when it's dark and stay awake when it's light. And insomnia is typically the byproduct of something else that is keeping you from getting to sleep or from staying asleep. So that is what will help differentiate between the two diagnoses. And of course, the best person to be able to do this is a sleep physician. So look up your local sleep disorder center if that is bothering you and give them a call. In the general population, it's hard to estimate the total number of people that have this disorder just because it is so similar to insomnia. But it's typically seen more in teens and young adults. However, it can progress into adulthood if left untreated. Some of the numbers state that it's up to 16% of teens and young adults can experience sleep phase disorder. Now, typically what a sleep physician will do, they'll look at a couple of different things with regard to investigating this. If you are given the opportunity to sleep on your own schedule, do you have a normal quality of sleep time, and do you wake up refreshed? So, for example, if you go to bed, find yourself going to bed at 1 or 2 in the morning, and on your days off or on vacation, if you wake up at 8 or 9 in the morning, maybe 10 or 12, do you feel that you have any issues? Are you able to maintain wakefulness? Do you feel the need to take naps? The physician will investigate as to whether or not there is something else that can be affecting this. So, for example, with insomnia, there may be something else as far as another sleep disorder that may be contributing to the condition. We've mentioned sleep apnea in the past. It can sometimes present as insomnia. Also, a disorder called restless leg syndrome can keep people from falling asleep for several hours. So it can also mimic this disorder. Other medical conditions, pain issues, medication use that sometimes can affect your ability to get to sleep may be a problem. Sometimes substance abuse. We've all abused caffeine, I think, at a time or two. But caffeine use, nicotine use, those are the types of things that your physician will look at. They will typically have you fill out something called a sleep diary. And this is basically just a little form. Sometimes it's in a little booklet. And it helps you track over the period of about 2 weeks your regular sleep cycle. Time you go to bed, time you wake up, if you have any awakenings in between there, what you may have eaten, when your last meal was. And your doctor will look at that and also look at the clinical interview that they did to determine whether or not it's actually sleep phase syndrome or insomnia that is contributed to by something else. Now, usually in cases of insomnia and sleep phase syndrome, a sleep study isn't necessary. Usually the clinical interview and some sleep diary information, possibly even the use of an actigraphy, which is a unit that measures movement over about a 2-week period of time, may be used as well. But once the physician has made the diagnosis, it's very important to get any sort of circadian rhythm disorder treated appropriately and maintain that treatment over time. Usually with insomnia, some of the treatments for insomnia will include the short-term use of a hypnotic medication, something to help you get to sleep. And typically, after about 2 weeks or so of some sort of intervention like that, it will help. Also, the use of behavioral therapy, cognitive behavioral therapy specifically, can help with insomnia. Treatment for phase disorders will include our old friend melatonin. As you recall, melatonin is a hormone that our brain secretes when it's time to go to bed. It's triggered by light cues through our eyes, and it lets the brain know that bedtime is coming up. So your physician will probably have you start taking some of that half an hour, 45 minutes before your desired bedtime. Usually the dosage will start out low. Typically melatonin comes in, it's over the counter, and it comes in dosages of 1, 3, and 5 milligrams. So typically start with 1 milligram. You may need to increase that if you find that it's not being effective. In conjunction with melatonin therapy, the physician will also have you start what's called bright light therapy. Now, bright light therapy involves the use of, like it says, bright lights. These are at least 10,000 lux, so it's not like your regular 60-watt light bulb that you have in your lamp. You don't just turn that on and hold it close to your face, because that could be awkward. But these lamps simulate natural sunlight. Now, typically, if you have access to be able to get some natural light in your environment, that's going to be best. But there are devices that will mimic that with the bright light therapy. They come in all different shapes and sizes. I personally have one that sits on my desk. So usually during the winter months, I will have it sitting on my desk. It's best to start using it shortly after you awaken, because what it does, it helps your body reinitiate its circadian cycle with light and darkness. Some patients that suffer from this will have bright lights installed in their bathrooms in the morning, so that when they go into the restroom to take a shower, they're actually exposing themselves to the bright light therapy that they need. And typically it will be for periods from 30 to 90 minutes. Your doctor would work that schedule out with you based on your sleep information, sleep diary, and the sleep questionnaire that you would have filled out. Typically, it will take a little while for these things to take effect.
Now, treating sleep phase disorder can be a sticky widget. I spoke with Dr. Mohammed Saad. He is the chief of medicine for the pulmonary critical care and sleep medicine department at the University of Louisville Physicians and University of Louisville Healthcare. He is also the medical director for their sleep disorder center. He points out that while it is ideal to try to work your way forward around the clock, working your way backwards around the clock can be very difficult. Unfortunately, not a lot of people have the luxury of taking 3 weeks to move their sleep phase up around the clock to get it back to a normal time. So most people opt to try to use different types of treatment.
Unfortunately, it's not one of those things that you can start doing taking these steps and have relief the next day. We see is that your sleep specialist will help you adjust your circadian clock at about a half an hour each time. So, for example, if you go to find that you're going to sleep at 2 in the morning consistently, they may have you take your melatonin. Say you want your desired bedtime to be 11 o'clock. Initially, you would start taking your melatonin later than that, 1 o'clock, just to start telling your body that it's time to begin getting ready for bed. The bright light therapy will initiate at your desired wake time, but again, it's going to be something that will be adjusted back around the clock. So half an hour at a time. Usually you want to do several nights on that schedule and then bump it another half an hour up until you reach your desired bedtime. Now, once you've reached that desired bedtime, it does need to be maintained because you have a propensity for readjusting your circadian rhythm. As I've mentioned in other episodes, our bodies really do like our habits. So maintaining proper sleep hygiene, which is having a good sleep schedule, maintaining a regular wake time, even on your days off and on vacations, will be crucial. Now, all of that being said, if you are in a situation where going to bed at 2 in the morning and waking up at noon works for you, more power to you. Unfortunately, some people just simply find that they cannot maintain that type of schedule. So if you are one of those people, please contact your local friendly neighborhood sleep disorder center, and they will be able to help you get that issue taken care of. I hope that you have enjoyed this episode, and I would really love to hear from you. If you feel like there is something else you would like me to discuss, please let me know. You can contact me at j@somnilopod.com. You can also follow me on Facebook, Instagram, and Twitter. And until next time, I do hope that you can get some good sleep. Thanks.